Now a troubling increase in coronavirus cases leading to a second shutdown in Newark.
Restrictions on non-essential businesses and recreation go into effect tomorrow. CBS 2's Jessica Layton live now with what this means. Jessica.
Well, Maurice and Christine, the infection rate here in Newark hasn't been this high since the end of May. The surge has the mayor calling for a second wave shutdown that begins tomorrow night at 8 p.m. And that has a lot of people wondering if the governor should do the same.
We're taking it real serious. I've lost family to the COVID.
Jose Olea is so concerned about coronavirus, he just recently started going back in public. Monday night, it was to buy some clothes in a store where the sign says he's at moderate risk. He wanted to do it ahead of second wave lockdown restrictions that begin Tuesday night in Newark.
If it's for our safety, I guess, yeah, but, it's, a lot of people are going to have no jobs again. People are going to, struggle a little bit again.
The 8 p.m. curfew affects all stores except supermarkets, pharmacies, and gas stations. Restaurants must close indoor service by 8 p.m. and outdoor service by 11.
Large gatherings are still happening, and the restaurants and indoor places have to be strict with the numbers that they're allowing.
Even outdoor play areas will be closing again in the East Ward, a section of the city where 25% of tests are coming back positive. The mayor says it's contributing to the city's 11.2% positive test rate in Newark compared to 5.2% statewide. Monday night, we saw long lines outside this testing center on Broad Street. The president and CEO of nearby University Hospital says hospitalizations have doubled since last week.
We have a community clinic positivity rate approaching 6%, past our 5% threshold for beginning our surge plan.
Governor Murphy wouldn't say how many cases it would take to send the entire Garden State into another lockdown, but he did hint that other hotspot communities may need to take a cue from Newark.
If we can't get a hold of this thing, that's probably something that as a consideration is going to have to become more meaningful.
And he also discussed the state's vaccination plan, saying he knows there's a lot of public skepticism, but once a vaccine is approved, he hopes compliance will be high.
When we meet these aims, we will meet our initial goal of vaccinating 70% of the state's eligible adult population.
The state is still also concerned about contact tracing. Too many people still not cooperating when they get that phone call, which could mean that the infection rate here in New Jersey is even higher than we think. Reporting live in Newark, New Jersey tonight, Jessica Layton, CBS 2 News.
Jessica, thank you.